I mean, you talked about asking people if the communication was appropriate.
Mm.
And I mean, how did that go? How did you just say, is it okay if I call? I mean, what kind of?
Yeah, actually, it was more about just calling them and saying, is this a good time? I'm calling to check in to see how you are. And really starting that as the conversation and listening to them, talking a little bit about what we had been doing in the community as Cape Cod Healthcare, but listening to their concerns. And a lot of times in the very beginning, that did not involve any kind of an ask. We really tried to make it appropriate to each and every donor because we realized that everybody was at a different place. Some donors were deeply affected by this immediately, both financially and from a health perspective, and some weren't, and that changed over time. But I do think that being the calm and fact-based resource for them in the community was hugely important and really helped build credibility and trust with our donor base. We did a lot of follow-up thank you phone calls. We did a lot of stewardship about where this money was going and how we were actually responding and reacting to the COVID pandemic. And then we started asking.